Okay, thank you very much. Thank you very much indeed. It's my great pleasure now to introduce three speakers for whom I have a huge amount of admiration and respect, not least for their work in improving animal welfare in veterinary education and practice, the theme of our final session. Perhaps some of the most memorable and important funding provided by AWF were for some Animal Welfare Foundation lectureships at three of the UK vet schools. And Dorothy McKeegan and David Main are two of them. And it's great to see that Jennifer Duncan is in the audience as well. So their good work has continued since that funding. There's been a lot of collaboration. David is Professor of Animal Welfare at the University of Bristol and an RCVS recognised specialist in animal welfare science, ethics and law. Dorothy is now a senior lecturer at the University of Glasgow. So they're going to tell us about some of the most recent work that they've been doing, which I think relates to the scenario that we saw this morning, actually, with the pigs. So I remember from my own pig placements at university on EMS, learning how to tail dock, learning how to tooth clip, and learning many other things. This project will look at some of the welfare assessment capabilities that are increasingly required of vet students and some of the ethical reflection that goes around all of those procedures and activities. So without further ado, Dorothy, please. Thank you.
Thanks, Sean. Good afternoon. So David and I would like to tell you about a project that's just finishing called Maximising the Value of Extramural Study Placements on Cattle, Sheep and Horse Units. And although the work was originally carried out on these species because it was a Norman Hayward grant from AWF that funded the project, we've obviously now extended that to a much wider range of species. And the work we're going to describe is really the work of three PhD students, Carol Batchelor, Annie Kerr and Federica Monti. So we're really talking about their work, not our own. So it was a collaborative project between the universities of Glasgow and Bristol. The overall aim was to enhance veterinary students' learning from preclinical EMS in particular. I want to talk first about what we did at Glasgow, and then David will come up and talk about the Bristol part. In Glasgow, we focused on the ethical challenges, and we wanted to improve veterinary students' ethical awareness during their EMS experience, using their EMS experiences, and also as a sort of side project to investigate moral development in students and also in the wider profession. So why are we interested in ethics? As I'm sure you all know, this is an ethically challenging profession, and we're trying to improve preparation for that in veterinary education, and we're still learning how to do that. Obviously, vets commonly face dilemmas. We were hearing about them in the transport scenario this morning. And we have some evidence of moral distress or moral fatigue and decision-making fatigue in vets who are trying to make decisions perhaps without adequate training to do so. And it's reasonable to assume that good decision-making and good moral reasoning are linked. So improving these skills is very important. It's really vital that veterinary graduates have sort of day one skills in ethics. Why are we interested in creating a kind of reflective tool for preclinical EMS? Well, this was because we knew from the experiences of many vets we spoke to, and students too, that they were encountering problematic situations and ethically difficult situations, sometimes for the first time on their preclinical EMS. And they were finding this difficult, and it was perhaps almost a bit shocking or causing what we call a spontaneous moral reaction in them. And there was no formal outlet for coping with this or reflecting on this. And we saw an opportunity to use these experiences to improve their ethical reflection and ethical development. And reflection, as I'm sure you know in the professions, is a big part of education. It's used to encourage consideration of multiple perspectives, to minimise negative emotional effects of these sort of events, and to maximise the learning potential of experiences. So we tried to make a guided reflection to help these first and second year students to use one of their own personal experiences on EMS, and we asked them to focus on the ethical dimension of an animal welfare issue. So we developed something called the Animal Welfare Associated Reflective Exercise, or AWARE for short. And I'm not going to go into a lot of detail, but these are the major parts of the AWARE. For the purposes of research, there was a background information section so we could know the gender and age and whether the students had a previous degree and so on, just to help us understand their responses. But then the students choose an animal welfare-related event or issue, which I'll come to in a minute. Then they have to do a personal reflection on this. How did it make them feel and why? And then we guide them through an ethical reflection of this. Why did it strike them as wrong or good? How can that be defended or otherwise? And then there was a kind of roundup, a summing up of the overall experience. For example, would this change the way you would approach this thing in the future? So just to mention how we asked the students to choose an event or issue, this was the self-directed part of the exercise. They chose a personal experience they had on EMS. Just because of the way the research happened in time, a lot of these were sheep placements with lambing, and you can imagine on lambing there were a lot of issues coming up. They could choose a positive or negative animal welfare impact event, but as you can imagine, most of them chose negative welfare events. There were a few positive ones. And we asked them to distinguish in a particular event, so perhaps a one-off occurrence, that might have been whether or not to move a casualty animal, for example, or a wider issue, for example, tail docking an entire group of lambs, and whether that was ethically justified. Then they were asked to do this personal reflection, which tried to capture this spontaneous moral reaction of the students. What did they feel when they experienced this thing, or witnessed it usually, and why did they feel that way? And it was very hard to get vet students to say what they felt and why, but we eventually managed to get them to do it. Then we have this ethical reflection section, which is really getting them to start becoming more ethically aware. Just asking them to identify who was involved, who were the affected parties, the ones that could be benefited or harmed by the situation. That's usually involving the animal or animals, the farmer, the stockman, but there could have been a vet involved or even the student themselves. We asked the students to indicate what they thought the principal interests of those parties were. So, for example, for the animal, that might be to avoid suffering, and for the farmer, it might be cost effective, to just get them to start thinking about what is important to those different stakeholders. And then they were asked to construct arguments both for and against the action that they witnessed or were involved with, so they could try and see it from both sides and defend it and attack it. And we also asked them in a more theoretical sense to take on perspectives of different ethical frameworks. And I won't go into which ones. We taught them 3 major ethical frameworks that deal with our duties to animals, and asked them what would a supporter of this framework think of this event or issue, and so they could see different sides of the same thing. Even if it wasn't their own perspective, they could recognise that others might have a different view, which is a very important skill in ethics. So the whole package also is part of a computer-assisted learning package, a CAL, and it's part of a thing called Moodle that we use at Glasgow, and it was linked to a similar system at Bristol. We had lectures recorded for it, so the students kind of plug in, listen to the lecture, and it tells them about why they're being asked to do the exercise and what it involves and so on. They get some introduction to ethical frameworks as well. And there was a couple of worked examples, which for the research used pigs and poultry, because we asked them to do cattle, sheep and horses, just so they couldn't copy the worked examples, which I'm afraid students might do, if not dissuaded from that. And just to say that we did validate this tool, we obviously thought it looked nice and so on, but we want to check, does it really elicit reflection? Does it improve ethical awareness? So we gave it to a full first-year group, and we did Carol did various types of validation. She looked at the content of what the students wrote, and very helpfully, we had some unstructured reflections from previous years of EMS students who were just asked to write an A4 page of what happened to me on EMS. So we had those unstructured, non-guided reflections to compare with. We also did some tests of their moral reasoning ability before and after doing this exercise. We asked the students to give us feedback of what they thought of it. And we also had a measure of how well they engaged with the exercise. And I won't be able to tell you all these results. I've just got a few things just to illustrate the validation. So this is the first one. This is looking at the content of the actual awares compared to the unstructured reflections. So the pale blue is the aware and the dark blue is the unstructured reflection that was, admittedly, it's from different students, but it's an overall comparison. And this is percentage content. You can see that the unstructured ones are mostly descriptive writing. The students just said, I went to a farm and there was 80 sheep, and, it's all very descriptive about the sort of situation, whereas much less of that in the aware. No feelings at all, really, in the unstructured, but they were giving us feelings in the aware because we were asking them to. Why they felt that way, only really in the aware. Evaluation of action, not much different, but they were producing arguments for and against action in the aware, showing balancing type statements, understanding that ethics kind of a balancing approach, and, of course, very much more significantly on ethical reflection, occasionally seeing it in the unstructured ones, but always pretty much in the aware. So it's really doing what we wanted to do. It's eliciting these kinds of content. Just to show one example of student feedback that we got, this is asking the students whether they felt that after completing the Aware, they recognise animal welfare issues more. Yes. Ethical issues more, better able to reflect on my experiences and to respect others' viewpoints. I think these are all key aims of the tool. So again, most of the students either agreeing or strongly agreeing that the Aware helped them to do this. So the Aware was a success, or is a success. The students readily engage with it and they use it to consider relevant issues. It significantly enhanced ethical reflection and awareness. The students were they self-reported improved ability to recognise issues and reflect on them. We did actually do the pre and post ethical reasoning ability test, and there was no difference. But really, the Aware wasn't about improving ethical reasoning ability, it was about improving ethical awareness. So it's kind of a step below full ethical reasoning, so we weren't so surprised by that result. It seems to be a really valuable approach, and it isn't the only ethics teaching that they will get, but it allows them to take some of the ethical concepts out into the field and think about them in context of their EMS. Just to mention as well, we've focused there on preclinical for the research, but Carol also created a clinical Aware, which is a similar structure, where they can reflect on an event they see when they're on clinical EMS, and also another tool called the Reflection on Professional Ethics, which they can use if they see a professional ethics, colleague-based RCVS type issue. And these have both been trialled and used successfully as well. Just the second short part of my part, I want to just mention that we also did some work looking at moral development, which we think is really important to be aware of and to monitor. Basically, as we become adults, we do develop our moral reasoning ability to some extent, and there's lots of it's been measured in the past, and we use one called the Defining Issues test, which measures moral reasoning ability in adults over 18s. We used it because it's easily administered, it's been very well validated, and it presents the person that's being tested with a range of hypothetical scenarios that are dilemmas and asks them for their responses, and then a score is generated from the way they deal with these dilemmas. And we applied this test to first year and fourth year veterinary students, different cohorts, veterinary professionals, and we split this into practising, so sort of first opinion, and academics, which were referral and academic vets in the university, and also the members of the public as a control. First thing to say is that first and fourth year are not different. It looks like fourth year are lower, but it's not significant. So hopefully we're not having a retardation in ethical development over veterinary education at Glasgow. But basically whatever we're doing at the moment is not enough. We're not getting a big enough jump between first and fourth year. We tried to do final year, but the numbers were not big enough to really make a meaningful comparison. It may be that ethics teaching has to be different or more, but there was work from America, 20 years ago now, that did show a genuine reduction in ethical reasoning ability between early and late years of the veterinary course. So we're at least not doing that. We're staying the same now, which is improvement. But we can, I think we definitely can do better, and I'd be interested to hear suggestions of how we can better do that. And this is a really interesting slide, which is ours looking at qualified vets. So we have practising vets, first opinion, we have academic vets, and we have members of the public. And basically, if you do the stats on this, and they're not huge numbers, about 50 practising vets, about 40-odd academic vets, and I think it was 60 members of the public. The test is quite onerous and takes a long time to fill in, so it's quite hard to get vets to fill it in. But we managed to do. Carol chased them down. So it's an opportunistic sample as well. But basically, academic vets are better than the public at moral reasoning, but practising vets are not. So that's quite an interesting result. As professionals, we'd expect them to score higher. So a lot of the majority of this group were given no ethics training in college or in uni. So I presume many people in this room are in that situation where they were just learning on the job, and I'm sure doing a good job, but being asked to do an ethically challenging job without specific training. So these have implications. This is the first data we have for UK and vet students. A really wide range of abilities. I just showed you the mean scores there. Really wide range of abilities. Some practising and academic vets using childlike levels of reasoning to solve these problems. Our vet education isn't good enough in terms of moral reasoning development, and a lack of consistency in qualified vets. I think we need better CPD in ethics. That's a whole other topic, but that's something I think we need to look at. And at the moment as well, that test that we're using to get that data is based on human dilemmas to do with escaped prisoners and societal issues. It's not about animals. And animal ethics is complex, and it's got another whole area. So we're currently, with Carol, pursuing funding for her to get a postdoctoral grant to look at developing a measure of moral reasoning ability with animals included that would be relevant to vets. It may be the DIT is not the best measure. And I'll just pass over to David.
Thank you for that, Dorothy. Yeah, so the Bristol part of this, we were obviously developing educational resources as well. We were particularly interested in the welfare assessment side, and so we did a consultation exercise with various vet schools, etc., and seeing what needs to be done with these vet students. And there was a consensus about better welfare assessment, but also a strong need to have better communication skills. So we landed up after all the project work was done with 3 educational resources, 1 on welfare assessment and 2 around communication skills, which I'll just talk about a little bit of the validation work on those. So first of all, the welfare assessment tool was a relatively straightforward online tutorial which contained video clips, multiple choice questions, feedback, etc., to rather stimulate the students into thinking about how to assess the welfare of different animals that were presented to them, and that work's been published. And we evaluated that online tutorial by looking at our primary evaluation by looking at students' reports of their EMS placements, because they had been asked previously for a long time, are the 5 freedoms met on this farm? Comment and indicate whether you think they could have improved, and if so, how. So they were asked to think about the 5 freedoms. And then we examined how the students responded to that question and whether they did these different tiers of learning through from remember all the way up to create. And we were able to see a difference for those students that had received the CAL, the online tutorial, that they were reporting, remembering more outcome measures and also analysing more outcome measures. And these were seen in 3 of the 5 freedoms for remember, increase in hunger and thirst, discomfort, pain, injury, disease. And also in analyse, we had increased ability to reporting and analysis in 2 of the 5 freedoms. So we seem to think that this online tutorial was generally helpful. As I said, we're interested in developing the communication skills, and of course there's a lot of work been going on in this in the vet schools, which is very important. But this was developing an online tutorial to see if we can contribute to that overall learning experience. So to do that, we had video clips of good and bad communication, and then we asked the students to comment upon those examples. And yes, those astute amongst you can see that's a rather youthful James Yates. I'm sure you can take the mickey out of him tonight if you see him having a drink. So the validation of that, well, what we did actually, we videoed vet students doing role play with actors before and after, and this is the baseline results. But the black lines are the individual parameters where the students didn't do what they could have done. In other words, was less good. And the findings from the baseline study was the main area that vet students struggled with was about displaying empathy and understanding. These are first-year vets. Perhaps you might expect it in role play, but I think it's a real finding. It's what we see also in the final year vets when we do assessments for them as well. Also had personal experience in the medical profession. I see that displaying empathy is actually quite a hard thing to do. So the evaluation we did, videoed these students before and afterwards, and we did see an effect of the online tutorial in the introduction section, in the listening section, and in the empathy section. So that we think it's a useful contribution to the communication skills teaching, certainly not on its own. So just a word about the communication skills teaching. The primary goal at the moment really is about to improve information transfer between client and veterinary surgeon, the Cambridge-Calgary model, and I think it does that very well. But what it doesn't do is influencing. I've talked in this forum, and I've written in the veterinary record about how, as vets, maybe we should be influencing clients. So we also did a workshop exercise to see if vet students were aware of the potential for influencing. Doctors are becoming increasingly aware of their role in influencing, and they've developed a technique called motivational interviewing, where, because they recognise simply giving clients advice to change is often unrewarding and effective, and they are being advised to use a guiding style, use the patient's own motivation, and also to encourage change talk from their patients. And the AWF is supporting a project on this led by Kristen Ryer, which is looking to see if we can use these techniques for improving dairy cattle welfare. But the exercise that we did was we just simply did a workshop exercise with vet students of different groups and also farm insurance assessors as well, actually. And we asked them, what could you use, what tactics can you use? And they reported similar tactics as what is advocated in motivational interviewing. They're not always used, but they are aware of these tactics. So the red light is on. So just to summarise, the legacy, I think, is yes, we've developed some effective teaching methods. 3 PhD students have gone through, and I think that's useful. The package has been integrated into a single package, which is now available at Glasgow, Bristol and Liverpool, and it is, because we're now formulated, all available to other vet schools. We're also in discussions with WSPA about see if we can disseminate these materials to other vet schools further afield. So thanks very much.
That was fantastic. Thank you very much. I think there was a relatively youthful picture of David Main in there as well. There were some challenging findings, I guess, from those projects, and I open it to the floor for any questions, please, or comments. One at the back, just second row.
Hi, Matthew Erskine, vet student from Edinburgh, so still in this realm somewhat. I was just wondering, the finding between first years and fourth years, obviously the degree of moral reasoning not increasing that greatly, or at all really. Do you think this is also something that should be looked at for students applying to vet school to do beforehand? Because obviously that's especially a time when people's opinions are very plastic and more kind of formative years of young adulthood, especially when we do so much work experience on farms in placements before vet school even starts. You know, that might set in stone some people's kind of opinions and values. So I wondered what your opinion was on that.
Yeah, it's a good question. There has been talk of a kind of hurdle to meet to get into vet school in this way, but what I'd like to emphasise, this is about skills. It's not about your values or your opinions in a sense. So these are skills that can be taught. So we'd like to think that whatever level you came in at, as long as it was, functional, we could train up to a point. And there's a lot of work in some other professions showing that certain amounts of types of teaching can make a difference. And Carol's Aware tool, although there wasn't an overall difference, the lowest scores came up. So it did help the people that were really not coming in at a very sophisticated level in terms of reasoning. So I think there's another whole argument whether we want to I wouldn't like to impose any value set or say you have to have these values to get into vet school. I think it's important that we're pluralistic and allow that, that mix to be there. And yeah, it is a skill, and I think it's not something you're sort of born with. It's something that you can be taught. It's just a case of finding better ways to teach it.
Going on from that, can you teach empathy, do you think? Or is this really, I really like the idea of actually presenting ethical dilemmas, because I think that if you can't teach them, at least you suddenly make people aware of other views. I think that may be a way, but I'm not sure whether we can teach empathy to vet students.
I think it's a difficult challenge, and I think some people are more natural at doing empathy than others, and speaking as a male, maybe slightly autistic person, sometimes I feel as though I'm not very able to demonstrate empathy, but actually I wrote an article that got published in the BMJ about this in human medicine, and really the words that are crucial are about words, friendship words. So should we be friends with our clients? Probably not. Should we be friendly with clients? Of course we should. But actually another useful concept is, what would a friend say in that situation? And actually I think that's quite an easy concept to understand, and that actually, when you're talking to people, well, what would I have said if they were a friend is actually an easier concept that I find to teach anyway.
Just coming in on that as well, if we're teaching the students to understand and respect other viewpoints, then they're more likely to be empathetic towards those viewpoints, even if they don't agree with them for certain reasons. So I think the ethics side of it works in with the actual skill of actually showing that you're empathetic. It's when, you might feel it but not be able to show it. So,
David at the back.
David Williams, EWG in Cambridge. And I feel that you need to show by example, don't you? I worry that in university, lots of students don't feel that their lecturers are particularly empathetic towards them. I try to be, and maybe we ought to be doing more of that.
I think we'll just leave that one.
Yeah, well, there's some vet students here. Maybe we can have some comments. Yeah, I think we should all be empathetic with each other, be human. Not a bad eye.
there another one at the back? Yeah, thank you.
Thank you. Richard Casey from PDSA. I've thoroughly enjoyed your discussion so far, and music to my ears listening to you talk about influencing. I've heard a lot today about our focus should be like to the care and welfare of the animal. However, I think sometimes it's easy to forget that that animal has an owner, and in order to get that welfare of that animal improved, we have to go through that owner or client. What I'm keen to kind of understand is, when you were working with your trial, did you have many differences between the consistency of students when they were looking at the 5 freedoms, and how varying were they on their analysis and scoring of that?
They were quite good, I would say, at answering those questions. I mean, the 5 freedoms is something that they get as a concept, pretty robustly. But I think the skill of using it in the human-to-human thing, though, is something that is more work to do. All the 5 freedoms.
We'll just take 2 more. Frida, please, with the mic, and then one over here.
Frida Scott Park. For the past 30 years since I left vet school, actually it's even longer than that now, we've hosted preclinical students on our farm. And it's always given me a huge amount of interest, because I love watching, them sort of settle into life, initially on the dairy farm and now with a beef enterprise. And we've hosted almost exclusively from Glasgow, Edinburgh and Cambridge. And 3 sets of students are completely different. But I would also maintain, after 35 years, that the most successful vet has bags of common sense and lots of charisma. And the ability of them to empathise with the problems that we see on our lovely little organic farm, with all its challenges, not enough money and everything else, is different in each set of students. And I just love watching that. And I do think it's, for many of the students, it's horses for courses, and some are going to be brilliantly suited to an academic career. You can just see that. Others are going to be fantastic general practitioners, and I hope to God they're welcomed with open arms. And some of them I don't think should have been vets in the first place.
I just think, coming back, it's interesting you say you're comparing these sort of cohorts of different vet schools, and David might want to comment, but obviously I try and keep my teaching as value-free as possible, apart from saying that animal welfare is important, which clearly we're not going to not say, but in terms of which ethical perspective they take, it's very pluralistic. But it's interesting whether, apart from, there might be other people teaching that are implying, and I think this value-based teaching is maybe what a lot of people in this room had once they got into practice. They were sort of told what to do and not given the actual tools to do the reasoning for themselves.
Last one, please.
Hi, I'm Bob Summerwell, Nottingham vet student. Just in response to the comment from earlier about lecturers perhaps not showing the empathy that you would want, just from my experience, and it might perhaps contradict what Dorothy said earlier from her results about academic versus practicing vets, I found that the lecturers we have who are practicing vets perhaps talk a lot more about the welfare and showing empathy towards patients than perhaps research staff might. But another thing I'd like to say is that, do you think being able to ethically train students at vet school could play a role in helping them to sort of cope with the stresses of being a vet, and therefore play a positive role in reducing problems such as depression that you see at the moment?
Absolutely. We're pursuing funding at the moment to look at that, we've linked up with a mental health professional at Glasgow to try and do a PhD project to see whether, to investigate the scale of moral distress related to ethical challenges, and also to see what training interventions make a difference. So, absolutely.
I think that's a really worthwhile point to end on. Thank you very much. And I think we're all reassured that AWF's money is being spent brilliantly. Thanks to both of you again.